Hi everyone, welcome to Center of Balance Live. This is number 47 live. Yeah, that's great. All right, happy Friday. So we're gonna talk about tooth pain. Well, a lot of people, in your life, maybe one or two, probably three or four. Yeah. So I'm gonna show you some acupressure point how to press some point that can reduce tooth pain. Okay. Now, if you're on Facebook, you need to check the disclaimer. Yeah, so you need to read through all the disclaimer before you apply on my YouTube as well. In the description, there's a disclaimer as well, so you should read that as well. So now, I remember that my wife it was probably 4 or 5 years ago. Then she went for uh, remove her wisdom tooth, right? So wisdom tooth is very painful. Okay, I still keep mine. I have no problem with that, luckily. So in some stage, you will probably suffer from tooth pain. So most of the time you have to go to see your dentist, right? That is the right way to go. So you should go. You should first. And um, if your dentist, eh, uh, give an examination or wash your teeth and whatever, sometimes you still feel the pain, and the pain is keep us ongoing, and they probably put you on antibiotics or painkiller, and tooth pain is not going to kill you, but it's very uncomfortable. You're not be able to sleep well, you can't eat properly, or sometimes you can't talk. And it's very annoying, if you have the experience. Luckily, I don't have a lot of that kind of experience. Yeah, I do have some. Then, talking about my wife, she went in for removing her wisdom tooth, and she didn't have any anesthetic, you know, no injection at all, no anesthetic, and no drugs afterward. Could you believe it? That is amazing, and I'm always so proud of her because she she was an acupuncturist, okay, but not anymore, no longer practice. But she still know the technique, So she brought in the acupuncture needles and just stick some needle on herself, and while the procedures just stimulate the needle herself. That's it, And then she got out the dentist clinic and then came home, and I did some more needle for her for about a week. Then everything's fine. That was fantastic. That was very, very good experience for her, and not very good experience for tooth pain removing, but was good experience to get acupuncture done and without any drugs. So that's drugs free. So any of you would like that. That is amazing. Okay, so this is our experience. And I recently, a few months ago, my mother-in-law had tooth issues. I said, well, you should go to a dentist, and she did. Then one of the teeth need to pull out, and that was normal, for dentists to do. If you went to go and see a dentist, this is something that you expect that something's going to happen. Pulling the teeth or filling your teeth, something like that. Then my mother-in-law had 3 anesthetic, and it was still painful that they couldn't keep going the job and pulling it out. So the dentist said, well, we just have to stop here. I can't give you any more anesthetic. So she came and asked me, what can acupuncture do? I said, well, acupuncture is very good for pain, and acupuncture has been there are some research and study in China that they have heart surgery without any drugs. And it's actually on YouTube, on a BBC documentary, on the BBC. If you search acupuncture for heart surgery, helping heart surgery in BBC, and it was very famous YouTube. So a scientist actually went to China and took this documentary, and that girl was having surgery without any drugs and just some needles in there, and she was still conscious. And then it was a big surgery, okay, and within 1 week she walked out of hospital. And that they couldn't do that if they give her anesthetic and there was very major surgery. So, yep. And yesterday I have a patient who told me that he was going for a root canal. So stay until the end. I'm going to show you the acupressure, but I just want to share something about this first. And he told me, I'm not quite sure the result yet, okay? Because I told him that, I have some experience in treating this. I have other patients came in as well, okay? So we help this as well. But I said I have not many experience in that, because most people just go and to see dentists, right? Whatever dentists say, you just do it, But that pain, if acupuncture can help that pain, reduce the pain, and you don't have to take a lot of drugs for it. Or if acupuncture can help you when you have anesthetic and that is still very painful, and if acupuncture can help that, that's great, isn't it? And because you don't want to go twice. Like my mother-in-law went twice, and then the second time, and she came in for acupuncture first, and I left some scalp acupuncture needles and put some ear point for her and asked her to press it while the dentist did his work, and put some acupressure point. I'm going to show you later. And that was it. And she had one anesthetic and then pull out the teeth beautifully. So that job get done, you see. And she told me that it wasn't painful. And even afterward, I did give her some herbs to for the pain, and she kept doing the acupressure point, So, and it was fine, no pain afterward. Even afterward, and the first time she couldn't even bear the pain, and it was so bad. So you see, so this is the difference between acupuncture when acupuncture involved, So acupuncture is phenomenal for pain relief, including tooth pain. So I'm not quite sure about the last patient I see yesterday, that he hasn't. He will come back and let me know how the procedure was going. It was yesterday. It just happened that before he went to his dentist, and he came to me for some other part of the hip pain or lower back pain. Then I said, well, I'm happy to do some needle for you. And so I put some needle over here and over here, and I asked him how to press those points while the dentist. So if you go to your dentist, okay, I'm not saying that I can treat your tooth pain. Whatever you have, just come to me. I'm not claiming that, okay? So you should go to your dentist. If dentists say whatever they ask you to do, you should follow. Then if you still have pain, then we are happy to help you. Okay, with afterward or before that, and sometimes you have to wait for the pain to reduce. You take antibiotics, and if antibiotic doesn't work well for you, hey, acupuncture is available for you. Then, even though this is some point that when you go for dentist, you can press it. Everyone can do that. It's easy. I'm going to show you that. Okay, if you're not sure, welcome to our clinic. Okay, we're happy to show you person to person. Okay. So let's show you over here. As you can see here, right? So on Facebook, let's show Facebook friends first. So you see all the meridian here, and meridian over here. Here, so this is, we call Yangming meridian. Here you go on YouTube. I hope you can see it. This is one meridian here, and the other one meridian here. Of course, that count too, but we mainly work on, most of the time we just work on Yangming meridian, and Yangming meridian come with large intestine and large intestine and stomach. Those two meridian. Okay. Then those two meridian went to face, right? So related to the pain of your tooth. Then over here, you probably know this point is very good for headache, right? But you need to get to the right point first. Second, if you just get one point, it may not work well for your tooth pain at all. You know, it's an area you need to know how to detect the point. Okay, I'm going to show you. So if you have your thumb, this is my right thumb. You probably see it on the left side, whatever. You can see the crease over here. Okay, and it matches the line over here. You see? Match to match the line, and where the thumb is. Okay? So lay the thumb over here and here. This is the point. Okay, this is the point. And then what you're gonna do is, if you press it like this, you're not gonna, you don't have the string to do that. So turn your forefinger to here. Okay. Oh, itchy nose. So 4 fingers holding here, and this is how you do it. Okay. So we call this is the first metatarsal bone, second metatarsal bone, which is on the index fingers come to here. So over here, next to the bone, okay, the point that we just located was in here, over here, in the middle between here and here. Okay, so you want to do, this is large intestine 4, large intestine 4. And what you're going to do is, you're going to press from here to here, along the metatarsal bone and closer to the bone. Okay, not on the bone, closer, right next to it. So from here, press until you get to the corner, to the corner of first metatarsal bone and second metatarsal bone. Okay, until you get to here. So if tooth pain in the back, it normally happen in here. If tooth pain more in the front, it'll be in here. If tooth pain from here to here is in the middle, then that will be in the middle. So if you just press in the middle, that'll help the tooth pain. It probably all help, but in the end, there's still some pain. That's because you didn't get to the right point. If you do this, this is good for here. So how do you know that? You don't have to know that much knowledge in here in the meridian. Yeah, you just know what tooth pain. It doesn't matter which side. So you go to either side of your hand and find out the most sensitive one. Okay, so from here, work slowly, press, and see if that's painful. You need to press it and rub it for 60 seconds. Count to 60. And then keep working. If there is another one, go for it. If there's another one, go for it. You might find 2 or 3. Okay, just work each of the point. Okay, once you finish here, so you may get another point over here. So next to the first metatarsal bone. Okay, next to it. Okay, you can try next to it as well. Find anything that is next to it. Okay, next to the first metatarsal bone, you want to press it as well. So if you go to dentist, if you're dentist, you don't mean lay down, right? So you just press, put it in the tummy and just press, get to the point and press it. Before you go to dentist, you know, before you walk in, you press all the point, all right? And while you on the chair, laying over there, you can still press on it as well. Just try to press on it, because you have free hand, right? You just press on it and massage it, and while the dentist helping you. Okay. So this is the technique I just show you. Okay. Again, you need to read the disclaimer that I just show you. I just mentioned to you in the beginning. Now, we can say about something about TMJ. TMJ is a lot of people go to see dentists, right? Now, you probably miss out a lot of TMJ that dentists can help you. And acupuncture is phenomenal for TMJ. TMJ is the pain over here in the jaw. It's very painful when you walk, when you eat, and when you talk. It got pain over here, and acupuncture is very, very good for this treatment. We have the very good experience in helping TMJ patient. Now, all right, this is it. Today is Friday, and happy Friday. And if you or your family or your friends suffer from tooth pain and or TMJ, you can try those products I just show you. It's gonna be very useful. You'll find it. It's gonna help the pain. But if you want to get it treated properly and you want us to help you, then we have 15 minutes free pre-assessment. So you can call us on 078467956, 078467956 to book in a free pre-assessment. So we're happy to see you. So stay awesome, and I love you all. See you tomorrow night. Bye bye.